Thank you very much, and thank you very much for inviting me to speak today. I'm a service user myself, and I live in the Hywel Dda University Health Board area, and I'm a member of the Wales Mental Health and Wellbeing Forum. And just to give you a little bit of background before we start about the forum, this was a co-produced group in the first place. So it involved service users and carers, third sector organisations, statutory sector people and people from the Welsh Government. And the idea was to create a group of people from across Wales, service users and carers, who would bring a voice of service users and carers to the process of putting into practice the 10-year Welsh Government strategy called Together for Mental Health. So we began our life at the end of 2013, and the majority of us are active locally in our local mental health partnership boards, who are responsible for seeing the putting the strategy into practice at a local level. We then have a number of members who are there to improve our diversity. So these are people from minority communities, with people with protected characteristics, and people with minority diagnoses that aren't otherwise covered by our membership. We also have a number of members on the National Partnership Board who oversee the putting into practice of the strategy at a national level. And our members at this board will take agenda items from us to the board, which demonstrate our priorities and work that we've done to improve mental health services. We have influence over a number of pieces of work. So we've influenced the outcome measures and data work. We've influenced the work on psychological therapies and on the workforce plan, as well as the liberty protection safeguard. And we've also been invited recently to sit on a board with the police nationally. So there's lots of opportunities to influence nationally through membership of the Wales Mental Health and Wellbeing Forum. We are seeking new members at the moment, and I just have to take this opportunity to give us a plug. I'm going to be sending a email to Linda, which has the details of how to apply if you're interested. We're not just looking for members of the forum to improve our diversity at the moment. We're also looking for members of the National Partnership Board. So we need a service user member of the Partnership Board, and also a carer deputy member of the Partnership Board. So if you're interested, please do look out for that email and get in touch with us, because we'd be very pleased to hear from you. Okay, I'm going to share my screen now. And I'm going to be talking about the Wales guidance on best practice in service user and carer engagement. This is not just about co-production, it's a much wider project to look at all levels of engagement. So the forum was commissioned by the Welsh Government to produce this document to follow on from the documents Stronger in Partnership 1 and 2. And if you haven't come across those documents, they were developed to put forward the best practice and the aspirations for service user and carer involvement at the time they were produced. They do need to be updated, and we need to underpin the consistent standards across Wales now, and to inspire and drive forward co-production and service user and carer leadership in mental health in Wales. I'd like to expand a little bit on what we mean by service user and carer leadership, as it's different to co-production. This is where the power balance is reversed and service users and carers take the initiative, drive the project forward, and take responsibility for the outcomes. There are a number of projects in Wales that meet these criteria, and there are also projects in the UK and across the world. So this document aims to look at all decisions about mental health made in all partnerships and organisations who deliver or influence mental health services. It sets a baseline expectation for all and makes recommendations for action. It's built on lived experience of the various representatives on the forum over a period of 7 years. So the forum has about 30 members, but these are constantly changing. So we're actually talking about the experience of a lot of different people. And the document is a discussion document which opens up various debates and controversies. It has 3 sections: engagement, recruitment, and reward. Now, the engagement section very much sets the scene. It gives some definitions of what we're talking about. It talks about what we hope to achieve in Wales, and it goes into co-production principles, for instance, something that I'll pick up again briefly in a moment. In terms of the controversies, we also looked at how to hold people accountable to be representatives and asked difficult questions like who should hold representatives to account and how we keep them working in an ethical and high quality way, and ensuring that they're representing not only their own point of view, but also the point of views of others who they may not agree with. Now, our responses to this have not been showing a consensus, so this is an area where we will need to have much more discussion before we can make strong recommendations. The recruitment section deals with the service users and carers who make a contribution to decision making as a workforce. And like many of the mental health workforces in Wales, this is a workforce where we're struggling to attract enough people to do the work that needs to be done. And if we achieve our ambition of increasing the number of opportunities to influence decisions across Wales, we're going to need even more people. So this section focuses on how to get the right people involved, to extend the number of people who are involved in the discussion, and also looks at how to develop careers for people who want to make this a lifetime piece of work. Finally, there's a section on reward, which gave some information on welfare benefits and financial and non-financial rewards. And we made the bold recommendation that service users and carers should be offered, first of all, in terms of reward, financial reward, on the basis that it won't be appropriate for everybody and people should have the option of other rewards. And we were very surprised, actually, about the amount of consensus on this. There wasn't the degree of debate and discussion that we expected. So there are a number of additional resources at the back of the document, including a paper on evaluation criteria from across the world. And although this sounds dry, it's actually quite inspirational, because these are the criteria that people want to measure themselves against, the way they want to define their success and how they are inspired and what they aspire to. There's an awful lot in here, and there's no way any particular project or organisation can meet all these criteria. So there's something there for everyone to develop what they're doing going forward. We had a copy of the engagement pathway, which is based on the ladder of Einstein's ladder of involvement, which has been mentioned a couple of times in this conference already. And what we found from responses is that we need to make this a bit clearer, because people haven't understood some of the more basic levels of engagement. And then finally, we had a sample job description. And this was drawn up by service users and carers to describe the role they wanted their representatives to fulfill. So the consultation ended at the end of January, and we're now at the stage of analysing the responses, looking for emerging themes. And what I can say already is that there's a clear need for engagement to be local, contemporary, and service specific. And this is where I want to mention co-production principles again, because our principles are somewhat different to the principles introduced at the beginning of the conference, put together by the Wales Network of Co-Production. And I think this illustrates that co-production principles are very much based on the values and development level of people in the room. And it's really quite useful on every piece of work to think about how you want to be working together, what your values are, and what you want to, principles you want to underpin the way you're working. And this way, we'll keep those principles alive, we'll keep them conscious, and we'll keep them relevant and up to date. I then want to talk about rewards, because again, this is something that is very different in local areas. And I have to say, in Cardiff, there's been a very strong lobby for financial rewards, at much more basic levels of the involvement ladder than in other areas. And probably when we're setting minimum standards, we'll find that Cardiff will well exceed those standards in this area. So I wanted to say well done for that work that you've been doing. Probably the most common thing that's coming through from the responses is a plea for earlier involvement in co-productive processes. And this is something, again, we've heard several times in this conference already. And I think is a sign of the frustration people have that they haven't been involved earlier to date. So we're trying to pull out clear recommendations and standards.
Nothing we need to worry about right now.
Sorry, we want to pull out clear recommendations and standards. And also one of the challenges raised is that we need a structure for putting guidance into practice rather than just have it sitting on the shelf. We've developed a large resource of best practice examples that we need to look at and draw out the learning from. And we've also identified a need for ongoing opinion and best practice research. In other words, to continue this conversation and this co-productive process going forward. So what are the next steps? And this is where I'd like to hear from you about what your ideas are about what we should do with this guidance. These are some ideas that we've got. We want the new guidance to reflect the responses we've had, to role model the fact that consultation doesn't have to be a process of simply tweaking what's already done. We're looking at producing a separate document, including the recommendations, actions, and minimum standard expectations, to make sure that those expectations and actions are clear. And then to have supporting document, because we found that a lot of the information that we've been gathering is time relevant and needs to be kept up to date. We'd be launching those recommendations in April in a conference with Welsh Government, and we've yet to hear from them what that will be and when it will be. So that may slip a bit in time, but we'll keep you in touch with what's happening. We need to develop ways of putting the guidance into practice, and two ways that are immediately available are to embed the recommendations into the mental health workforce plan, and we've already started to campaign for that, and also to include it in the emerging new 10-year mental health strategy. As both these documents have plans for action with them that carry resources, because the responses have also shown that people need substantive posts and financial resources to make things happen on the ground. And finally, we need to plan ongoing research to feed into supporting documentation and development of updated document in future when this one's lifespan is finished, which will be at the very latest 2031 to 32. I'm going to stop now and give you a chance to have some input. And I'm also happy to answer any questions about the process, the document, or about the forum. Thank you very much.